Hey everyone, welcome to Medical Careers You Didn't Know About, where we shine the light on hidden heroes of healthcare. I'm your host, Infinite, and today we're exploring a career that plays a powerful role behind the scenes. One that helps patients access care, support financial systems, and bridge the gap between providers and insurance companies. If you're looking for a meaningful, stable path in healthcare, you're in the right place. Be sure to like, comment, subscribe, and share this video with someone who needs career inspiration. And don't forget to check out the link in the description below for additional resources to help you get started. So with all that being said, let's get into it.
Step into the world of infinite intelligence, where knowledge meets entertainment and brilliance. You'll find the answers to life's greatest questions. With every video we spark new obsessions. Infinite intelligence, we're here to elevate. Unlock your mind and let the wisdom resonate. We dive into the depths of the universe unknown. Infinite intelligence and knowledge is our own.
All right, so let's begin your journey in this dynamic field of healthcare administration as an eligibility specialist. This is a comprehensive roadmap guide that I have put together that'll help you through the stages of this rewarding career path, from entry-level positions to senior management roles. Okay, so discover the skills, certifications, and experiences needed to succeed in this essential healthcare position that bridges the gap between patient, providers, and insurance companies. All right. So, what is an eligibility specialist? What is their role? An eligibility specialist is a healthcare administrative professional who verifies patients' insurance coverage and financial eligibility for medical services before treatment is provided. The key function in this role is to serve as a critical bridge between the patient's healthcare provider and insurance companies, ensuring services are billed correctly and the patient understands their financial responsibilities. Now, the impact of this role is their work directly affects both financial health of the healthcare organization as well as the patient's access to afford care, making the position a significant responsibility. And I really cannot stress this enough. The eligibility specialist is a part of the front line in dealing with the patients. We have to make sure we have the correct insurance to make sure that everything is billed correctly. And that also means, making sure that, because if you don't have these things built correctly, it could leave the patient having patient responsibility as well as holding up claim processes as far as getting the claim paid in a reasonable amount of time. And we want the claim paid before 120 days. All right. So, what are the core responsibilities of an eligibility specialist? One is to verify insurance, confirm insurance statuses and benefits for upcoming visits or procedures, ensuring coverage is active and applicable. All right. Financial screenings help patients understand out of pocket costs and determine eligibility for financial aid programs and payment plans. Okay. Documentation and data entry, entering in insurance details accurately into electronic health recording systems, maintaining complete patient financial profiles. All right, that's a key important role. And coordination with payers, like I just mentioned earlier, coordination of benefits, COB, contacting insurance providers to verify benefits, resolve eligibility issues, or maintain necessary prior authorizations. Now, there is such thing as an authorization specialist, but a lot of times the eligibility specialist will just verify to make sure they are eligible. All right. So, what are some of the position titles in this field? All right. So one of them is the one that we're going over now, which is the eligibility specialist. And the standard title for professionals focused specifically on insurance verification and benefit determination. All right. Next, we have, I think I'm going to go down. Next, we have the insurance verification clerk, which is totally different from the eligibility specialist. This is the data entry position, typically handling routine verification processes within a large healthcare system. So they kind of go hand in hand, okay? But it looks like they're solely verifying insurance, okay? So patient access specialist combines eligibility verification with frontline desk patient registration responsibilities. A financial counselor emphasizes the financial guidance aspect of the role, helping patients understand coverage and payment options. And benefits verification specialists focus specifically on confirming insurance benefits for medical services and procedures. So these are the titles that are listed in this field, okay? So they're interchangeable uh, as well as dynamically somewhat different, okay? So now we're going to go into the education. So the first stage, entry and foundation. So you will need a education, high school education, diploma or GED, um, as well as a possible. You don't have to have an associate's degree in healthcare administration. It is recommended for a better opportunity. But you do definitely want to brush up on your medical terminology, basic insurance concepts, and there are classes available that will get you started with that if you are starting with a zero slate. You're starting at nothing, all right? And they are affordable. So essential skills, you're going to have to accurately data entry. You have to have accurate data entry abilities, meticulous attention to detail, very much so, basic insurance knowledge, clear communication, and basic computer efficiency, proficiency. All right, and tools. See, some of the billing tools, and this is different places that you go. One of the billing tools is they have Epic, Cerner, Meditech, which is very old. Um, but and you'll get training on that. Once you get the position as far as the billing systems, but you want to be aware of, just a heads up of the different systems that you'll be working out of, and also pursue a HIPAA training and consider getting certified healthcare access associate, which is a credential to stand out. All right, entry level positions start typically between 32 and 45, depending on the location and the type of facility. All right. So the second stage is early career development. You want to gain practical skills. Focus on developing effective, efficiently in routine verification tasks while maintaining high accuracy. Start building knowledge of various insurance plans and specific requirements. All right. Handling complex cases such as progress to managing more complicated insurance situations, including pre authorizations, Medicaid and Medicare verification, and coordination with billing department on challenging cases. All right. And that's not to say that you need to know everything, but you just want to have a good concept. You want to have a good concept. You don't want to walk in it blind and unaware, because that's just not, you don't want to do that with anything that you do. All right. So improve productivity, develop systems for managing high volume verification requests effectively while maintaining quality. Learn to recognize common denial patterns and how to prevent them. I keep saying effectively and efficiently wrong. We're going to keep going. All right. So building patient communication skills. So enhance our ability to explain complex insurance concepts to patients to understandable terms, especially when delivering difficult news about coverage limitations. So, obviously, when you get into the breakdown of insurance and coverage, sometimes that can be a little bit of complex information to relay. So, you will be, responsible for relaying that information. All right. So, what is the third stage? The third stage of a skill expansion and specialization. All right. So, you can further your education by maintaining a bachelor's in health information management or public health. You can also maintain your credentials by getting professional certifications such as the CRCS, which is a Certified Revenue Cycle Specialist, or your CPC, Certified Professional Coder, and as well as specialized knowledge, which is the ACA, which is Affordable Care Act programs, charitable care policies, and coordination of benefits. All right. So at this stage, professionals typically earn between 55 to 68,000 as they gain specialized expertise. This investment in education and certification leads to stronger job security and opportunity for cross training in related areas like medical coding and case management. All right. So, stage 4, this is going to be advancement opportunities. And we will start from the bottom up. So, we have technical knowledge, which is advancement system expertise in workflow optimization, quality assurance, audit protocols, and error reduction, analytics abilities, data analysts, and process improvement, and have leadership skills such as team development and performance management. As your role, excuse me, as you progress to the role like eligibility supervisor or revenue cycle analyst, which typically pays between 65,000 to 80,000. Yes, you'll balance technical expertise with leadership responsibilities. Success requires both people management skills as well as deep understanding of the healthcare financial systems. All right. So these are some of the skills that you will need to maintain to uh, continue to be a benefit in the organization that you are working at in regards to making it to stage 4. All right. And stage 5, which are senior roles and diversification, such as revenue cycle manager, which oversees entire financial journey from registration through payment collections. You'll manage multiple teams and be responsible for key performance indicators related to clean claims and reduce denials, which is a huge responsibility in itself. You have a director of patient access, which leads on the front end revenue cycle operations, including registration scheduling and eligibility verification. This role requires strategic vision and ability to implement department-wide improvements. Very key role. And healthcare consultant. You can leverage your specialized knowledge to healthcare organizations and optimizing their eligibility and reimbursement process. This path offers flexibility and typically higher compensation for those with proven expertise. So senior professionals with 5 to 10 years of experience can expect salaries such as 80,000 to 120 plus, particularly in leadership positions and specialized consulting roles. All right. So, core certifications worth pursuing. Okay, all right. So let's get into some of these certifications. We have a CHAA, and that is with the NAHAM organization. You can find this information online. This certification is excellent for hospital-based roles, focusing on patient access functions. Okay. The CRCS, you can get a certification with the AAHAM. And once again, this is not a sponsorship. This is just information sharing and knowledge. This is ideal for understanding the complete revenue cycle and billing processes. The HIPAA certification, which is with various providers, requires baseline for positions handling patient data, and the CPC, and you can get that with the AAPC, which is valuable for those looking for expanded knowledge in the medical coding. All right, and some of these organizations have all these certifications within them. All right, this is just like a breakdown. All right, so I've already went over the salary overview, but this is a graph that gives you just more of a visual understanding on where it lies. All right, and at the bottom it has that the salary ranges vary specifically based on geographical location, facility size, and individual experience. Urban areas and large healthcare systems typically offer higher compensation compared to rural settings or smaller practices. Advancing your education and obtaining industry certifications can accelerate your progression through the salary tiers. Okay? All right, so what are some of the advancements and challenges? Because everything has that. So the advantages, I said advances, advantages and challenges. So the advantages with this career are relatively quick entry into the healthcare field. So it is relatively quick to get in, as long as you've covered the foundation that we just spoke about. It is a clear career progression path, which we went over just now. Stable employment with healthcare demands, opportunity across many settings, meaningful impact on patient care access, skills transferable to other healthcare roles. All right. So, what are some of the challenges with this career path? High accuracy demand with repetitive tasks, constantly changing insurance regulations. That is so true. Things are constantly changing. So it might be one thing one day and one thing another, but you just gotta flow with the changes. Emotional patient interactions about costs, high productivity expectations, need for continuous education, and balancing speed with thoroughness. Oh, that is perfectly said. You have to be a multitasker to a degree, but definitely focusing on what you're doing. And like it says, as you start off slow and you pick it up as you go, right? So, understanding both the reward and difficulties for this career path will help you prepare realistically. While the role comes with administrative challenges, many professionals find deep satisfaction in helping patients navigate the complex healthcare financial landscape and enabling access to needed care. All right. So, what are we going to do now to get started? So, you're going to start working on your foundation, which is research healthcare administration programs. And you can do this at community colleges or online schools. Look for courses like medical terminology and insurance basics and healthcare systems. All right. So if you're serious about getting started, you can do that today. You can do that right now to go ahead and get this journey started. All right. So after that, you want to gain experience. Start applying for entry-level positions at medical offices, hospitals, and insurance companies. Consider receptions and administrative roles to build transferable skills. All right. So next, you want to join healthcare administration groups on LinkedIn, and once again, this is not a sponsorship. And attend local meetings with I go to the AAPC meetings, but they also have AHIMA and the AAHAM chapter meetings to connect with professionals already in the field. And lastly, research requirements for the CHAA certifications and create a study plan. Many employers will value entry level candidates who show intuitive towards certification. Initiative. I said intuitive. Initiative towards certification. All right. I had a brain fart, y'all. So, with that being said, this is the end of the video. What did we learn in this video? We learned to create a foundation. First, what we did in this video was decide that, hey, we wanted to know what an eligibility specialist is. No, what is the first thing that let's go back. Yeah. First, we said, hey, I want a career in healthcare. I'm not a doctor or a nurse, but what are the options out there? So we stumbled upon this video letting you know that you can possibly become an eligibility specialist. So in the midst of becoming an eligibility specialist, we went over the roles, the key functions, and the impact of this career. We went over the responsibilities in this career, as well as the other titles and positions that are interchangeable in this field. We also went over the education, the certifications, and skills needed to be successful in this role. We went through the stages of development and in this career path, as well as the skills, the analytical abilities, the quality assurance, and technical knowledge needed to be successful. We went over the final stage as you climb the ladder of where you will be if that's where you intend to go. Okay? And if you are needing additional resources, all right, so here is the PDF that I have put together. Is more in depth with more in depth information that goes more in tune with the role, the skills, the positions, and additional resources to help you get started. And a lot of times people do like having something tangible because you might not have time to rewatch the video, or they need to do things at their own pace. So you can definitely click the link in the description below and get this PDF. It is available to just help you out, to have something tangible to look at, to help you get started. Even if you have it and you got it and you need to come back to it, it will guide you the same way this video did. All right. So with that being said, thank you for joining me in this journey of medical careers you didn't know. If it sparked up your interest or helped you learn something new, show me some love by liking the video, subscribing, and sharing it with your friends to help them with their future in healthcare as well as yourself. And like I said, click the link in the description below for a full roadmap guide to help you with your next steps and being confident and staying motivated in this field. All right. It can get a little overwhelming, but as long as you take your time and just take it one step at a time, because it's not a race, you'll do fine. So until next time, I'll see y'all in the next video. Bye.